In today's video, I'll share with you tips for how to succeed and get the most out of your clinical experiences in nursing school. If you're new here, welcome. I'm Liz. I'm currently a family nurse practitioner, but before that I was a pediatric nurse and an adult med-surg nurse. And over the years, I have been obviously a student and I've dealt with all the students. Some amazing ones, and then some ones that left a little bit of room for improvement. But don't worry, after today's video, you will definitely be a member of the first group rather than the latter. All right, let's start off super basic. What do you need to bring to clinical? This can be stressful because the internet seems to tell you you need to bring the entire world to clinical. Fortunately, friends, this is not true. Now, in terms of like the day-to-day stuff, so like what you're going to put on your body and what you're going to actually bring with you in terms of survival, so like compression socks, a jacket, chapstick. Do not leave your home without chapstick if you are going to a hospital. It's like the Sahara Desert and your lips will dry and fall off. I have a video on what I actually wore to work as a nurse and have everything listed just of like what to put on your human before you go out the door. And I think that could be really helpful. I will link it here down below. You can go check it out after you watch this video. And it gives just a good idea of basic supplies that would be helpful for anyone working in healthcare to put on their body before they leave the door. But guys, after you kind of get down like the what's going on your person checklist, there's really not a whole lot that you actually need to bring with you. And I'd like to use this time to address something with some of you. And I mean this in the most loving way possible. Don't be a clipboard student. In my years, I have seen dozens of nursing students walking around units in the hospital with a clipboard clutched in their hands like it is the most precious object they have ever owned and they are afraid someone's going to steal it from them. Put the clipboard down. Why? Well, first, the clipboard is not confidence inspiring. If you walk into a patient room and you are clutching the clipboard, that automatically sends a red flag to the patient that like, okay, this person might be, looks a little bit nervous when you're standing there like white knuckled. The second thing it does is having a clipboard there really encourages you to look down at the clipboard rather than looking up at what is happening. And all the action is happening out here. The patients are up here, the alarms, the bells, all the good stuff is up here, not down at your clipboard. Got me? Good. And I'm not in any way saying don't keep notes because everybody needs a place to write down their notes. I wrote down everything in the entire world. I needed notes. But I'm gonna let you in on a super fun little secret. Scrub pants are the best pants. Why are scrub pants the best pants? Because they have about 8 pockets, most of them running down your leg, a couple on your butt. And in this pocket is where you can place your conveniently folded nurse brain. So a piece of paper you kind of fold into fourths and shove it into your leg pocket, or you can put your little notebook that you brought to clinical with you, something, but then you can keep it on your person. It's always with you, no clipboard, and if you need to shove it in your pocket to use those hands, perfect, done. This also gives you a way to have access to writing notes down really quickly, but you're not lugging this clipboard thing around because chances are you're gonna have to put the clipboard down with your notes to go and do something and then you'll lose it and it's a mess. This is super easy. This is what all the nurses do. This is what all the doctors do. When you see everyone running around, they have their notes folded, squashed in their pant legs. So why don't you just be cool and start off right away and be like, yeah, I have my notes in my pocket. It's not a big deal. And side note, if you want a video on how I do my nursing brain and basically keep track of all my patient information, I'll link that one down below too. I just used a piece of paper, folded it in fourths, shoved it in my pocket, good to go. Write your name on it. Don't forget to write your name on it. Nothing worse than losing your nursing brain, even as a student. After you write all those notes, you don't want to be that. All right, guys, so I guess we went on a little tangent with what you don't need. Let's really quick recap what you do need in order to go to clinical. So you need, obviously, your outfit, your scrubs. You need your stethoscope, a pen light, a pen, a piece of paper, which you can steal from the unit's printer, a notebook like this. So I have this little one, I will link it down below. I love it. I write all my notes, all my questions. We'll talk more about that later, but a little notebook to go with you is a great idea. You're gonna want your chapstick. You're gonna want maybe like a med drug reference book so that you can keep in your backpack in case you have to go look up the mechanism of action of like Lasix, something like that. But really guys, that's about it. The internet is gonna tell you you need all these other doodads and goodies. Do you need them? No, friend, no, you do not. Nursing school is expensive. Let's try to minimize this cost and just go with what you absolutely need. Now you know what you're gonna wear, what you're gonna bring, your pockets are full, you're excited, you're ready. Let's talk about some friendly suggestions. Don't sit, don't ever sit, unless you are charting or looking something up on a computer. Other than that, your booty should be out and going. You have a very limited number of clinical hours, so you should use them. If you don't have any immediate tasks that you need to absolutely do, ask your nurse if she needs anything. Other techs, other nurses, anyone you see. Hey, do you need something? Answer call lights, whatever. Just do something. When you're answering call lights, you probably won't be able to address most of the issues. Side note, before you go and get someone water that they ring this bell for, make sure that they're not NPO. That would also be a catastrophe. There should be a sign on their door. But at least if you're going and answering call lights, then you can kind of triage the problem to the right person. Like, does this need to be addressed by the nurse? Could the tech maybe handle it? And then whenever you are going to solve these problems, go with them then. Like, oh, this person needs pain medicine. Hey, can I tag along while you give them this pain medicine? Oh, we need to do a bed change. Oh, can I help you do the bed change? Let's learn this new skill. Answering the call light and triaging some of those issues introduces you to so many different opportunities, and you're seen as helpful, which is always delightful. Because let me tell you, friends, helpful students learn the most. Because as a nurse, when I'm gonna go do a cool procedure and I'm gonna pull in a student, I'm gonna go pull in the student that's been answering my call lights, or at least just offering me help. And I'm gonna go find them and pull them into my cool procedure that I'm doing. And you're gonna gain more awesome experiences through that. Clinical is your time to learn. Yes, like classroom stuff is important, yada, but this is the best time to learn, and you don't have forever. And it always blew me away as a nurse when I was running around like a chicken with my head cut off, and I would zoom by some nurse's station and there were 3 nursing students just like sitting there chatting. You are not the human that I'm going to come to and be like, hey, wanna change the central line dressing with me? No, friend. I'm gonna be like, oh. So even if you don't feel like you can be helpful, you will be more helpful than you even know just by answering some call lights or offering help and letting that person know what task you are able to do. I promise it will be helpful. Just offer your help, be kind, be present. Now, while we are on the topic of learning new things, you need to be your own advocate in terms of what you need to learn in clinical. Before each day in clinical, you need to sit down and come up with your goal for that day. Maybe before the semester you can sit down and have your goal for the whole semester, but definitely at the beginning of the day you need to sit there and be able to have an actionable goal. Like today I want to give an IV med and I want to learn how to change a PICC line dressing, do a head to toe assessment. Whatever your goal is, have it in your head so you can communicate that to your nurse, because the nurse that you're paired with doesn't know you. They aren't probably familiar with like where you are in school, what skills you have, what you don't know. So they're gonna ask you, hopefully, hey, what do you wanna learn today? What's your goal? And then you can tell them, and that nurse can either give it to you kind of with their own experience with your own patients, or she can find other people to be like, hey, that person has a PICC change. You go over with them at 1 o'clock, you'll do it then. Or they'll seek out opportunities for you, but they can't do that if you don't even know. I can't tell you how many times I ask the student, I'm like, what do you want to do today? They're like, oh, I just want to like learn everything. That's not helpful to me because I can't really make that actionable. I'll just be like, all right, I guess you can follow me all day and we'll try to like teach you little things. I can teach you one skill really well if you communicate that to me, but everything is kind of challenging. Another really good thing to do at the beginning of your shift is to just kind of powwow with your nurse and let them know what skills you are comfortable with. That way they can utilize you better as a resource and your whole day is gonna go better, because if you're helping that nurse, the day's just, gonna be better, and you're gonna be able to do more things because they know you're competent to do them. So like, hey, I just wanna let you know, like, I'm very comfortable with vitals. I'm very comfortable with giving oral meds, comfortable with putting meds down a tube, yada, yada, yada. That way they can know, they'll still have to be there with you when you give meds, but maybe after they've seen you do vitals one time, they'll be like, okay, yeah, you're good. And they can utilize you as a resource, and then you feel empowered, like, hey, I'm actually doing something and you're being helpful. And the nurse will feel more confident in you that like, okay, yes, they do have these skills. I can trust them a little bit and go from there. Because I'm telling you, if you don't tell us that, I immediately would assume every nursing student I had knew how to do like nothing, because you have no idea what you're working with. So be clear when you communicate what your goals are and what your skills you already have are, what you're comfortable with. That way, delegation and advocacy for you as the student is a lot easier. Side note, you may want to write your goals and competencies down, because I don't know about you, but I was pretty nervous when I got paired with new nurses and they were like, what do you want to learn? And I was like, medicine? And what do you already know how to do? Talk? Like, I had more skills than that, but I would get nervous, and writing it down, always a good idea. So while we're talking about writing things down, let's talk about taking notes. This that we already talked about earlier is my clinical taking notebook, because it's teeny tiny, and again, I will link it down below. It's like a loose term something something. It holds up really well. It has a leather cover. Loved it. I super recommend having one of these that will come with you. You can write down notes in it when you learn something new, like, oh, this technique for placing an NG tube, or hey, this med has this indication. But more importantly, you can write down in it questions. You could write down also the patients that you see, the diagnoses. You could jot down, like, if you're sitting there, you're like, you know how you have to write your notes? You'll be like, oh, this person's nursing diagnosis is this, this, and this, while you're sitting there thinking about it, because by the time you get home and you're trying to write this thing up at 1 a.m., your brain is like, oh. So write down all of this stuff. I did this in nursing and NP school, little notes about what I was seeing, what the treatment was. That way you had something to reference when you go home and are writing your note. But anyways, like I was saying, another really good thing to put in here are questions, because sometimes you're going to be able to ask questions on the fly with your nurse and just be like, hey, what's this? But sometimes it's not going to be the best time. Maybe the situation in the room is tense. Maybe it's a chaotic situation and your nurse just doesn't have time to sit down with you and explain something really well, but you have a question and want it addressed. Just write it down in your notebook. Maybe you're in rounds and you're like, oh, that's weird. Like, why are they saying all that? Write it down. You can address it later with your nurse, with your professor, with, you know, in whatever group you're in, and it'll give you the opportunity to learn from it, and you'll forget it otherwise. Honestly, I had so many questions. I feel like sometimes if I didn't write them down, and I was like, oh, there was something, you know, when you do the after clinical, you're gonna huddle as a group with your cohort and you'll totally forget. But this would be a great way to look great and be like, oh, I have this question, let's discuss it. And that's one great way to stand out and get your question answered, because that's what you're there to do, right? Okay, so what happens when you're doing all the right things? You're being helpful, you're advocating for yourself, you're saying what you already know how to do, you're offering to do all the things, you're answering all the call-outs, and you are just with a grumpy nurse who didn't want a student and has probably awkwardly said, I don't want a student. Because you're gonna encounter them and it's gonna be fine. You're gonna have more nice nurses, hopefully, than those types of nurses, but they exist. I'll just warn you. Here's how I handle that. You just kill them with kindness. You don't, when they say, I didn't want a student, you just say, oh, well, hopefully I can be a little bit of help for you. Keep asking them, what can I do to help you? Answer their call-outs. Do all the things, just be really kind to them. Don't sulk in the corner and be like, oh my gosh, they don't want me. That's not gonna win them over. Just like by killing them with kindness, I have seen even the most grumpy nurses be killed with kindness many times. So hang in there, friend. You can do this. It's really hard to be mean to someone who is just obnoxiously kind to you and helpful. So hang in there. You might feel a little bit obnoxious, but hang in there. It'll be fine. Hopefully you'll get something out of the experience, and the next day you'll be paired with a much more cheerful nurse. Going along with unfortunate situations, what happens when you are a nursing student and there is a code, an RRT, some kind of an emergency? Because it may be tempting to go and want to be like right up in the action and see what's going on. This is something that can bring a lot of adrenaline. It's kind of exciting sometimes. But guys, codes are chaos and they draw a ton of people into this tiny room. And so it's really just best that you step back. You can either watch from outside the room or even more helpfully, go wander around and answer those call-outs, because there's gonna be a lot of nursing attention on this room and the other rooms can be neglected. Absolutely, if you wanna watch one or two, stand outside and just kind of observe, but it's really kind of awkward when there's students in the room and you have to ask them to leave and then they get offended and you're like, no, it's just like, there's 12 of us here and all 12 of us are playing a very important role. And this is crowded and chaos. And in a couple of years, you're gonna be that one of those 12, you know, standing around doing your thing. But it's gonna take a little while. There's a lot of training that goes into it. So in the event of emergencies, just kind of step back a little. It'll be fine. Unless you're invited by your preceptor. I was invited once in my PICU rotation in nursing school to actually like do compressions and do all of that, but she was very intentional about it. Like we talked about it before. She said, if there's a code, we're gonna go, you're gonna do compressions. So I knew exactly what my role was, but it was very talked through. And so if your preceptor does that, perfect. But if not, just kind of step back a little bit and it'll be fine. Talk about it later, learn from it, but don't be that person we have to kick out of the room awkwardly. And rapid responses, while we're on this topic, are totally different. That's when you are seeing a patient decline and you just need a lot more help. They'll call. Those can be great learning opportunities. Again, probably not the time to ask a million questions, but just stand there and there's gonna be a lot of dialogue between the treatment team and the nurse and the respiratory therapy and everyone, they'll show up and you can learn a lot through those. So those are a really cool opportunity to see and be a part of, but they're not quite as stressful as codes. So if there's RRTs, sometimes it's nice to be like the side wing of the nurse on those because you can learn a lot. More so than in a code, honestly, I think, because those can be a little bit of chaos. Oh my gosh. And now, I can't even believe I didn't mention this first. So this is one of the most important rules of all clinical things. Just always say yes. It may scare you. You may not feel prepared. You might be like, oh my gosh, what am I doing? But the answer if someone asks you, do you want to do this, is always yes. Do you want to access this port line? Uh-huh. Do you want to put this Foley in? Mm-hmm. Yes, the answer is yes, even if you feel like you're gonna poop yourself. Side note, if you're doing something new and you're really not familiar with it, I would probably pull your instructor in so you can talk about it before and let your nurse know hey, I haven't done this before, but I want to, but I haven't done this. And they can help you. They'll walk you through it probably before, and then you can go do it on a human. But these are the experiences you need. The scary ones are always the ones you really need. I learned the coolest things in nursing school by just being like, yes. Even when you were like, yes, I'm going to vomit right now, but yes, I learned the coolest stuff. And that's the perfect environment because they don't expect anything from you. All they're doing is trying to help you learn. So those are the major ones. Now let's just run through a few other quick but very important details here at the end as we wrap things up. Be early, look decent, don't wear perfume. You don't need to look like you're, you know, the most fancy person in the world, but don't show up looking like drool on your face, like you literally just rolled out of bed. And perfume can be offensive to a lot of patients, don't wear it. Next, you definitely want to portray confidence. Like I said, eye contact, look up, but don't be overconfident. Don't be overconfident in your skills. Ask all the questions. If you have even an inkling that like, I might not know how to do this, go grab your nurse friend and they will help you. Safety is the most important thing here, okay? Just be safe and ask all the questions. All the questions. This is your time to ask them all. And look up, guys. Look up. I know it can be uncomfortable. This might be the first time you're having conversations with people, but look up, look patients in the eye. Good eye contact and posture does immensely wonderful things for how patients view you and your own confidence. Patients will feel much more comfortable talking with you, letting you do things to them if you look up, stand up straight, look them in the eye, and talk to them. Treat them like another human being and don't act nervous, like fidgety looking down. That doesn't send off like the vibe of like, yes, I know how to take your blood pressure. That doesn't send off the confidence vibe super quick, and they're gonna be real nervous like, have you done this before you go putting some IV in my, like, I don't want this. And even if you're feeling nervous, like I said, deep breath, shoulders back, eye contact, smile, small chat about anything, literally anything, and it'll put both of you at ease. And maybe the most important tip of this entire chat is it's okay to feel like you know absolutely nothing. That is why you are there. No one expects anything from you. They don't expect you to have all this knowledge going in. Nobody feels prepared for clinical. I didn't feel prepared for clinical. I bet you probably don't feel super prepared for clinical. Your friends don't feel super prepared for clinical. But if you implement these strategies, you will be more ready, honestly, than you think. You already are more ready than you think. All your labs, everything has brought you to this moment, and you're gonna be just fine. You got this, I promise. Clinical is the fun part. Good job for you for getting here. Yay, you. All right, guys, I hope these tips were helpful for you as you are preparing to dive into clinical. Again, if you're new, welcome, I'm Liz, and I make videos that aim to make your life as a nurse and P student and nursing student a little bit easier. Don't forget to check out my what I wear to work as a nurse and my how I do my report brain sheet as a nurse video. I will link them at the end here and down below, and consider subscribing if you'd like to see more videos like that or this. Always have a question of the day, and that is, are you excited for clinical? I remember being so excited, petrified, but just so excited to finally get my hands in there and like do stuff. So fun. And I hope you're excited too. You can be scared, that's totally fine, but I hope you're a little excited. Oh my gosh, before I forget, eat breakfast. You gotta eat breakfast. Don't care what it is, but shove something in your mouth before you get to the floor. Otherwise, you're gonna be pulled into a room to help debride and clean out some tunneling sacral ulcer, and the pus is gonna shoot out and hit the wall, and you are going to almost faint. Not that I would know that from personal experience, but just eat breakfast, okay? Don't be me. Lesson of the day, always don't be me. All right, guys, I will see you guys next time. Have a wonderful day. Bye.